Before we dive into today's conversation, I want to share something a bit different with you. This is the first time I'm recording a personal introduction to an episode, and there's a reason for that. The interview you're about to hear is with Dr. Alasdair McKelvie. He's a man who's become something of a legend in South African dentistry despite being Scottish. For over a decade, Alasdair's been the person dentists in South Africa call when they're in trouble. As head of dental services South Africa and I think Africa at Dental Protection, he's helped thousands of practitioners navigate their most difficult professional moments. What makes this conversation unique is the timing. This interview was recorded at the recent SADA Congress during what turned out to be Alasdair's final visit to South Africa in his professional capacity. After 16 years at MPS, he was facing the end of a career that had taken him from his original plans. During our main plenary at that Congress, I found myself making a bit of an impromptu speech because I'd realized that this was probably the last time I'd share a stage with Alasdair, and I couldn't let the moment pass without acknowledging what he meant to our profession. After we both spoke, something quite cool happened. Hundreds of dentists and attendees rose to their feet in spontaneous standing ovation. I thought it was a moment that perfectly captured, what Alasdair meant to South African dentistry. Now, I've known Alasdair for a while, and I've been working with him for 5 years, which is the longest I've worked anywhere. We've worked together. We've disagreed loudly enough to require management intervention. You'll hear about that in the conversation. And we've become genuine friends, I believe. So to me, this isn't just a professional interview. It's a conversation between colleagues about an unexpected career journey from a reluctant dental student who never wanted to be a dentist to someone who found his calling in helping others navigate the profession's challenges and, being the person that people call in their worst moments. So you'll hear about his path from Scotland to England to South Africa. He's 23 years in clinical practice and how a single alleged malpractice case changed his perspective on record keeping forever. Now, if you know Alasdair, you won't be surprised that he shared his story with characteristic candor, the kind of honest reflections that come when a career takes a bit of an unexpected turn. Now, some of those insights, while perfectly valid, I felt needed to stay between colleagues, for my own professional reasons. If you know, you know. And I must just say to Alasdair that I'm grateful that he understood my position and still trusted me to share his remarkable journey with you. A few days after the interview was recorded, Alasdair worked his final day at MPS, and I wrote later that the banter between us was relentless, the mentorship invaluable, and that we were losing an irreplaceable voice in healthcare. And that is exactly what happened. So here's Dr. Alasdair McKelvie, a man who accidentally became a dentist, deliberately became excellent at it, and ultimately found his true calling in protecting others. This is our final conversation as colleagues. Hope you enjoy.
Welcome back, everyone. It's a conversation I'm really looking forward to. I've mentioned this in previous episodes. When you're close to someone, you don't ever have these overarching deep conversations with them for some strange reason. We don't go all the way back. And Alasdair McKelvie, Dr. Alasdair McKelvie is our next guest. If you're a dentist watching this show, he needs no introduction. He's one of the legends in South African dental industry. Yak, you're nodding for the listeners. but Alasdair McKelvie is the guy people go to, or dentists go to when they're facing difficulties in South Africa. That's the intro for the non-dentists out there. Alasdair, thank you so much for agreeing to come on the show. How are you doing, man?
I'm doing fine.
Yeah.
Pleasure to be sitting here with both you guys. I know you both, so I'm looking forward to the next hour or so and the chats. See where we go.
So you would have picked up his accent, right? He's not from South Africa, right? But he's an honorary South African.
Well, I've got the badge on, okay? So that makes me an honorary South African. But yeah, I'm Scottish.
Yeah.
Okay. Born in Scotland, grew up in Scotland, educated in Scotland, and that's when I left Scotland as soon as I qualified as a dentist, and really without a plan ended up in England.
Okay.
And for one reason or another, I've stayed there. My home is just outside Leeds in Menston.
But take us all the way back, Alasdair. So what growing up, what was it like?
So I was born in 1961. Okay, so that gives you an idea of how old I am. Okay, I grew up in a very secure family. My dad was a urologist, and we took the mickey out of him by calling him the human plumber, but that was mainly what he did. My mum was a physiotherapist, and they'd both met when they were training at Glasgow University. And we'd moved to Bridge of Allen, which is a small village just beside Stirling, where my father worked. He worked in Stirling Royal Infirmary. And that's where I was born. I was born on the campus of Stirling University in a maternity hospital, and brought up in Bridge of Allen.
So I didn't know this. So you come from a family of healthcare professionals.
Yeah. And academics as well. I mean, you were born in that environment, and you.
Do you know, from what I could see, my father was very much a worker. I mean, he went to theatre every single day. He had a huge, an enormous list of outpatient consultations every day as well. He did his private work after he'd done his NHS work, so rarely saw him because he was working all hours, and if he wasn't working all hours, he was out playing golf with his buddies.
Okay. And so what, are you the black sheep of the family that you just became the dentist, or how did that happen?
I don't know. I mean, listen, I mean, one of the things that I'm eternally grateful to my parents for was funding a private education for me and my two sisters. I'm the middle one, so I've got an older sister and a younger sister. And my parents always said to us is that they don't expect to inherit anything, because your inheritance we're using now to pay for your education. So we were very fortunate that we went to a great school not far away called Dollar Academy. And it turned out that I had the best grades of the three, but the journey to dental school wasn't as quite as straightforward as it might look.
Yeah, well, how did you just, I mean, because I always, when I speak to dentists, right, and I said maybe it irritates them, but I say, who in their right mind when they're growing up says, when I get old, I want to be a dentist? Was that your thing?
No, it wasn't at all. I mean, coming from a medical family, I think there was a bit of pressure on number one son to follow in father's footsteps and go to medical school. When in the summer holidays, from a reasonably early age, I used to pick up jobs in the Stirling Royal Infirmary. And one of my roles for 2 or 3 years over the summer holidays was as an operating department assistant. And I used to work with the anaesthetist, bringing patients from the ward, taking them into the anaesthetic room, putting them to sleep, putting them out on the operating table and recovering them on the way back. So not that I learned an awful lot, but I had an interest in anaesthetics and anaesthesia. And at the time, my uncle also worked in the hospital as an anaesthetist, and he had a big influence on my ambitions and what I wanted to do. So I wanted to do medicine and specialise in anaesthetics. That was the plan.
Yeah.
I mean, that wasn't really the plan for me, because at that time I wanted to be a pilot, but there just wasn't the opportunities to go into aviation, into civil aviation, other than join the Air Force and train as a pilot in the Air Force. And then once you've done your service, you got an opportunity to go into commercial aviation. It's completely different now, because my local airline, Jet2, are now paying to train pilots, and they're giving anybody the opportunity. So it's a completely changed playground. But that's what I wanted to do at the time, but there weren't the opportunities. So it was get your education, get whatever results that you needed to get into medicine, and that was the plan. And in Scotland at that time, you can have 2 bites at sitting your exams, your final exams, when you're leaving school. So in our 5th year, we did what's known as hires, and I messed those up because I was just too busy playing rugby and sport, and I didn't really get stuck into the work. And then, so I did a 6th year at school, redid a lot of those and didn't do any better. Okay. So I'd applied to do medicine, and I had conditional offers for a number of universities and medical schools, but I didn't get anywhere near the grades. So the opportunity was lost, despite all the levers my dad was trying to pull at the time. I didn't get into medicine.
Okay. You mentioned sport. I mean, I've heard that you're a bit of almost a professional golfer. Was that like a big thing?
It was a big thing for me, because I picked up a club very early in my life, probably swinging a golf club at the age of 10. Okay. And it wasn't really until I was about 15 or 16 that I actually became quite good at it. And there's a sort of eureka moment when you learn to play golf, where you can hit the ball hundreds of times in a round of golf. But there was a eureka moment where I shot a magnificent round of golf, and I started hitting it properly, and I thought, yeah, I'm quite enjoying this. There's something really nice. If you're a non-golfer, you don't get it. If you're a golfer, there's something incredibly satisfying about hitting the ball out the middle of the golf club, the correct distance and in the right direction.
So you must have heard this in your life, but there's a joke that says, what do you call a doctor who didn't go to medical school, right? You know it.
Go on, but I think I know what the answer is.
It's a dentist, right?
Yeah.
The doctor says.
So coming back to answer your question. Yeah. So there I am, towards the end of August, in 1979, not having a clue what I'm going to be doing next, and what I'm wanting to play golf, because I'd played boys international golf. I was playing for the local county. I was getting better, and I was quite enjoying the idea of getting even better with some coaching. So I'm quite happy thinking about having a year out, but my dad wasn't. And he said, look, if you want any more support with your education from me, you've got to find a place doing something else other than medicine. And we kind of had that discussion. Well, what do you think I should do? And I didn't think I was bright enough to work my way through law school, and my English wasn't probably as good as it needed to be, and that sort of side of my brain, that sort of reasoning and analysis, what didn't seem to be there. So my dad said to me that, I mean, he said, John Short, who comes to the house regularly when we have parties, well, he's a dentist and he makes far more money than I do. So I thought, oh, that sounds like a good thing to do. And
wait, sorry, as your dad said this,
yeah,
so the dentist made more money than the urologist.
He says, right, what do you want to achieve? I said, well, I'd still like to go into a profession that I can make a decent living from. Yeah. And he gave one of his friends as an example, and I applied to a number of dental schools, got into Dundee Dental School at the end of September, not really wanting to be a dentist, and actually never been a particularly comfortable patient at the dentist either. But there I was, enrolling into a 5-year course in dentistry.
Had you ever shadowed a dentist or?
No.
Yeah, it's similar to
and I tell you, half my class were people who had not got into medicine.
Yeah.
So there was a lot of people who fell back. There were very few that actually said that they were there because they wanted to do dentistry. But the majority were people who had failed to get into medicine.
Okay. And what was it like studying dentistry?
Brilliant. Okay.
Yeah?
Yeah, because
That's the first time the first time someone gave us positive feedback that it's studying was good. Usually people.
Well, the whole experience, let's put it that way. I love being at university and I made the most of it. And, I got some ridiculously low results in exams because, again, I'd lost my focus about what I was trying to do. And I can remember doing my physiology term exam and getting 11%. And I was thinking, right, well,
it's better than, less than 28%.
I'm keeping this quiet, okay? And the really crucial point came at the end of our second year when we sat our final exams in anatomy, physiology and biochemistry. And if you failed those, then you were facing the resit situation over the summer holidays. And I was pretty convinced that if I had to do resits, I wouldn't pass them and I'd be bombed out. So I actually got my finger out and did some work in the last term of second year and passed everything.
Wow.
And that was me through into the clinical years.
Were you looking forward to seeing patients, or was it like like dental school for me was the very stressful time of my life.
No, I can't say I can't say I was looking forward to the intimacy of the contact with patients and the idea that if you don't get this right, you can do them harm. And the other thing about sticking needles in people's mouth, it just felt slightly uncomfortable. But like everything else, is that you're watching everybody else manage it. So and they're probably feeling exactly the same, but nobody exhibits the sort of anxiety that you feel when you start treating patients for the first time. And I can remember. We used to buddy up, and I can remember whoever I was buddied up with was about to do probably his first inferior dental block with the tutor behind him, and he's kind of got his thumb in the right position, and this thing's moving around all over the place with a sharp needle in the end of it. And I can remember it was the clinician was a guy called Hector Ferrier, and he'd been shot down in a Spitfire in the Second World War, survived it. And here he was supervising the students. And I can just remember watching him, and he grabbed the student's arm and just pushed it and in one movement. And the syringe just went straight into the patient's jaw in exactly the right position. And the cartridge was emptied. And I thought, well, right, okay, it's not as difficult as it looks.
So you made it through dental school unscathed? There were no dramas or...
I don't think so. No. And I started to, in academically and qualification wise, I was probably one of the weaker students. But the more clinical stuff we got, the more I kind of rose up the class and felt a lot more comfortable.
Yeah.
Particularly when I finished, because when I finished, I'd applied for a year's work in the dental hospital as a house officer, and I got the two posts that I wanted. I got a post in the Department of Conservative Dentistry and one in the Department of Periodontology.
Okay, so you were looking forward to finishing off and starting work as a dentist. It wasn't like, I'll figure it out. Okay.
And just to I mean, I've always enjoyed working. So I worked in the dental hospital during the day, and then one evening a week, and on a Saturday morning, I'd go into a dental practice just adjacent to the school and do some work there as well.
Okay. And you guys don't have... You want to say...
Oh, and what's the regulation like surrounding that? Do you have to go into... Here we have a ComServe here where it's public sector. Yeah. You got to kind of qualify to get into private.
Yeah, no. The UK was just about to change, and introduce this thing called foundation training, and the foundation training in the UK is very, very similar to ComServe here, although I think there's probably, there's more supervision and there's more compliance and there's more checking, and if you don't complete your foundation year, you can't work as an NHS practitioner. Yeah. And there were nowadays just about everyone who graduates and some of the foreign nationals who come to work in the UK all do a year of foundation training. There are very few people decide to ignore it, because without foundation training you can't get an NHS number and you cannot work in the NHS.
So how was that process for you transitioning and getting into? You said, did you get into private quite quickly after qualifying?
I did the year in Dundee, and then thought, okay, what am I going to do next? Am I going to go down the academic route and be a registrar, senior house officer registrar, or am I going out into clinical practice, into primary care? And I went out into clinical practice, primary care. And it was at that point that I'm looking through the British Dental Journal every month to see what the job vacancies are, so I can find something that I really want. And I think this is 1985. I saw an advert for an associate in a practice just in the outskirts of Hull in East England, and the guy who was looking for an associate had just opened his practice, had become very busy, so there wasn't a book to take over. I was going to go there and start my own book working with him, and he'd an MSc in cons from the Eastman Institute in London, and that was a kind of sliding doors moment for me in my career, ending up with him, because he taught me how to do proper dentistry and how to do things really well. And I ended up learning so much from him, whereas had I gone somewhere else where the interest was more in output rather than quality and learning how to be a good dentist, I might not have got so much satisfaction out of clinical dentistry.
Yeah. I mean, to that point, the only other person that I know that's been down your route kind of is sitting next to me, but he kind of gave it up all the way at the beginning, like in his ComServe. Yeah. No, I knew it wasn't for me, but you practiced for like decades, literally.
Yeah, that was my point.
Yeah. 23 years. So
23 years.
Yeah.
What was it like being a dentist? Clearly it was okay because you did it for 23 years.
I put pressure on myself to do really good dentistry. And I can tell you what happened was that for 4 years I worked as this guy's associate. And he was the first guy I saw using rubber dam. Okay. He was the first guy I saw who, when the x-rays came out of his finished root canal treatments, I looked at them and went, that's good. And he could shape restorations the way I'd never ever seen before. I mean, he could make amalgam look like enamel and dentin. It was phenomenal what he could do with his hands, and I just wanted to learn that skill. We learned how to do our own wax ups. We used face bow transfers, centric jaw registrations, did occlusal adjustments. We did everything, and then we got this hydrocolloid machine to do hydrocolloid impressions, and this is where you warm the hydrocolloid up in a tray, stick it in the patient's teeth. And it's incredibly accurate, and you have cold water going through it that makes the hydrocolloid set. And then we went upstairs and cast our own impressions, and we just had it was fabulous. And I learned so much working for Alan Holland. It was amazing. It was an amazing experience until his wife decided they were going to move to Bristol, and they put the practice up for sale, and he wanted me to pay too much for it. And I thought, well, this is a great opportunity for me just to find a premises, put in a dental surgery and open it up, and that's what I did. I just opened my own dental surgery about 4 miles away, and most of the staff that had worked with me as an associate in Alan Holland's practice came with me because he'd disappeared. So, I'd a ready-made team, hygienists, dental assistants, and patients as well, and the opportunity to do my own thing, and that's what I did until the opportunity came to work for MPS in 2008. So that was 23 years in clinical dentistry.
What did you call the practice? What was the name of your practice?
There was no restraint of trade there.
No.
Clearly not.
No. Holgate Dental Practice, it was called. It was in a village called Cottingham, just outside on the perimeter of Hull. It was it was an affluent area. So, and what's more, I not only did I take a lot of my own patients there, but by association, a lot of Alan Holland's patients came with me as well. And I didn't need to advertise. And we started off doing NHS dentistry, but to a private standard, and it was not sustainable. And I had a good patient base, patients used to good quality treatment, so decided to come out of the NHS and offer them private dental care, and majority of them stayed, and we had a great time.
So how does the Medical Protection Society, MPS Dental Protection, come into the picture after 23 years? You just say, well,
no, it came into the picture. It came into the picture beforehand because I think my memory is correct here in that at one point round about the late 90s, 1999, I was chair of the local BDA branch. In
BDA is
British Dental Association. Okay, a bit like SADA here. So we have branches all over the place. And I was the chair, and I remember having to get some speakers to come along and do some stuff. And I'd met John Tiernan, who a lot of people will know in South Africa, because I had a problem, and I'd contacted MPS to say, this mad patient suing me, what do I need to do? And it was Tiernan who picked up my case and helped me. And from that moment on, we struck up a really good friendship. And around 2000, the dental protection was expanding, and they were looking to appoint independent contracting local dental advisors. And the idea was that they would have a team of 50 dentists who, when needed, would go out and see members of dental protection who'd run into difficulty, and it might be to help them improve their record keeping, or help them to sort out cross-infection issues, or help them with some addiction problems, something like that. So I became part of that local dental advisor pool, and got to know more people at MPS. I then was asked to come in and do the telephones 1 day a week. And I did that and enjoyed it.
What's the telephones like? You just answer calls from dentists?
Yeah, so it's very much what you guys do sometimes as well. But in those days, we had thousands of members. I mean, we really had the majority of the dentists as members in the UK.
Okay.
We take up to 150 calls a day from dentists, and they needed people in there to answer the calls and give the advice.
And they call you and say things like, well, my patient wants copies of their records. Should I disclose? All that kind of stuff.
All that stuff. Yeah, I've got a complaint. What do I do? All that stuff. Yeah. And, the dentists phone up because they've got a question they don't have the answer to, and they expect you to give them
so it's
the
not
answer.
always like a litigative question?
No, absolutely not. I mean, it can be an ethical question. It can be, what do I do about this patient? I've just shouted at the patient, or, things like that, or patients just swallowed a crown. What do I do? So.
Yak, have you been sued yet?
No.
Not yet?
No, not yet.
Okay. 23 years, you've got a track record of just one
Well,
issue.
it was one case, but
it taught
record. It taught me an awful lot, because...
What were they suing you for? What was the issue?
It was a patient who I felt desperately sorry for her, because she had a condition that was known then as refractory periodontitis. It was one of those aggressive periodontal conditions that no matter how good her plaque control was, she just kept losing bone, and she kept coming in with perioendo lesions and pain. And I did my very best. And what was interesting was that she picked up an advert that she read in the paper where there was another practice, not a specialist, but another colleague in town, who was promising amazing results by using Q10 bioquinone at that time. And this woman was very upset that I hadn't provided treatment.
I actually remember in one of your lectures a few years ago, you mentioned this as a case study.
Yeah.
And you emphasized the fact that you should not just be treating what you see, but acknowledging the fact that something is there and bring it to the patient's attention, because she kind of sued you for something that you missed, or assumed that you missed.
She knew there was a gum problem, but she thought she was going. I should have offered the miracle treatment, and there was no evidence to support Q10. It's an anti-inflammatory type thing, and there's probably more evidence surrounding it. But it wasn't part of mainstream teaching, and the periodontists weren't using it either. Before that had happened, I'd sent her to a specialist, and the specialist said, "Look, there's nothing you can do. There's no point in doing perio surgery. Just keep doing what you're doing." But that wasn't enough for her, and so when I contacted MPS, there wasn't a formal claim yet, but they were wanting an investigation. I remember Tiernan saying to me, "Send in your records and we'll sort things out." And I sent in my records, and he came back to me and he says, "That all you've got?" And all I had was exam scale and polish, exam extraction. There was no charting, no measurements, no screening, nothing. I mean, they were pathetic. And after that case ended, I made a deal with myself that no matter what happened in the future, I was never ever going to hand over a set of records that could be criticised by the MPS, and it was through that case and getting involved with John that opened the door into MPS. And then in 2008 they were recruiting full time, and that's when I said, right, I'm 52 or 53 or something, I can't even count, and I don't want to be doing clinical dentistry till I'm 65 or whatever. And I was really, really enjoying the work I was doing for MPS just one day a week. I'd done a healthcare law degree in 2005 as well, while I was still working as a clinician. That was quite tough as well. But in 2008, sold my practice, and I was just ready to go, absolutely ready. And it wasn't because I'd fallen out of love with dentistry. It's just I'd find something that was more stimulating for me to do.
Yeah. And so what's it like being the person to go to when you're in trouble? Like, I do a similar role to you. I find it a privilege, like, to be able to help people when they are in need. Tell us about dental protection, your journey there.
I mean, I think it's a difficult one to explain to lay people what we do, okay? Because most people think we work for an insurance company. We don't work for an insurance company. We work for a mutual that's owned by our members, which is slightly different. But it's the easiest way to explain to the lay person is that, yeah, we indemnify or we insure these guys when they have an accident and they damage a patient. We pay to fix it and help them repair relationships with their patients and help them reassure the General Dental Council or the HPCSA that these guys are actually good dentists and they're fit to continue to practice without sanctions. So I really enjoyed that side of it. I really, really got a lot out of looking after the members and getting a successful outcome. So I'd kind of gone from treating patients to treating members. That's the way that I explained it. But I loved the interaction with the lawyers, and I loved the interaction with Counsel when we had a regulatory case. At the time in dental protection, I was also... eventually I kind of got a promotion along the way, and I was responsible for curating and setting up and delivering an event called the Dental Legal Study Day. And the Dental Legal Study Day was a brilliant day. We held in London once a year. We got some of the barristers to come along and speak on legal and ethical issues. And we were sold out every single year with people that were really interested in that sort of dental legal space. And that's where we picked up a lot of our future DLCs from them attending that event and saying, look, I really love what's going on here. And there was a time when I can remember one of my senior colleagues, a guy called Mike Clark, who worked for years at MPS, saying, guys, this is the best job in the world. And it kind of felt that at the time because it was the job everybody wanted in professional dentistry in the UK. They just wanted to be employed by dental protection. It meant that you were still in dentistry, but not having to do the clinical stuff, which for many was a huge relief. And there are plenty of people that do dentistry that actually feel like they've made a mistake, but can do something with their dental degree, and they don't have to do all the clinical stuff and be a primary care dentist. You're probably a good example of that. That it's actually come back to help you. But that was it. It was the best job in the world. I didn't feel like I was a celebrity, but I just felt that I probably made it in dentistry. You know, I'd been the co-pilot for years and years, to give the aviation analogy, and now I'm sitting in the left-hand seat with my lapel badge and
I think
stripes.
It's such a cool job, and I'm glad you mentioned the celebrity thing, because you're somewhat of a celebrity in South Africa in the dental industry. Yak's nodding.
Yeah, I mean,
we've seen that recently.
You see,
But how did you get to South Africa? How did that happen?
Okay, it was John Tiernan again, because there was two of us. Another colleague, James Foster, who has got a similar standing in Asia and Australia. And when the two of us came in, they said to us, right, James, you're going to do Australia with Kevin Lewis, who was the dental director at the time. And Tiernan said to me, he said, right, you're coming with me to South Africa. And I came to South Africa, and the very first place we went to was in that time PE Durban.
Yeah.
And that was where I watched him do his first kind of stand-up routine in front of a sizable audience. And from PE, we came over to Durban, where we are just now. And that was my first immersion.
But don't you feel like, oh, what do I know about South Africa? Like, why you just telling me do South Africa? We got to figure it out.
Was it your first time? Was it your first time?
It was my first time in South Africa, but my father's uncle was also a surgeon, and there was a connection in the family with Africa. So my father did work for a while in Sierra Leone. He came down and did staff training in South Africa. So there was a connection, and there was, you know, listen. What I really liked the idea of was actually doing a bit of travelling as part of my job as well. So when John Tiernan came to me and said, "You've got South Africa," I thought, great, let's do it.
Cool.
And see what it's all about.
Did you know any South Africans at the time? Have any friends? Nothing.
No.
Just let's figure it out.
The South Africans that came to the UK never came north of London.
Oh, okay. Yeah.
And what was the point of coming here at that stage?
Well, we had a membership in South Africa of probably about 3,000 dentists. Okay, and the administration of their subscriptions and their membership was done by SADA. So we had an arrangement with SADA that they would do all our administration. But when the cases came in, the cases were handled in the UK. Okay, so the whole purpose of visiting South Africa was to try and get people to understand consent a little bit more, go out, talk to people, do road shows, come to the SADA Congress, and meet members with the attorneys here, the members who had regulatory cases or claims. We would spend quite a lot of time sitting with members and going through them. And then the other side of it was John had all the stakeholder relationships. We didn't have a business development team in South Africa like we do now. So he did all the stakeholder relationships. So I got taken along to SADA and met with a variety of people that he knew and passed those relationships on to me.
Yeah, so it was, basically to increase membership as well.
It was,
if I can summarize.
the keys in for us in any jurisdiction are retention and sustainable growth. So the idea, in South Africa, you're not required to have indemnity, so it's an optional purchase.
Yeah,
okay, and so we're trying to improve safety in dentistry, improve the record keeping, but we're also trying to grow our membership by being visible and being around.
Yeah.
And there just isn't any competition. There wasn't any competition at that time.
Yeah. So that leads me to my next question, or probably for both of you. Comparatively, do you find that the UK was more of a litigative society compared to South Africa?
Yeah. There
and what's the trend now?
There are some clear differences because there's been a point in the last 10 years where we've been under significant financial pressure in the UK because of the behaviour of one law firm called the Dental Law Partnership, and they just saw an opportunity to process claim after claim after claim against our members for it was around failure to diagnose and correctly manage patients with periodontal disease. And they knew that there was a cohort in certain areas of the country who would be going to NHS dentists who wouldn't be getting the correct treatment. And they were absolutely right. And it was a gold mine for them. And so we just had claim after claim after claim around this failure to diagnose and treat periodontal disease. Come to South Africa, I can think of probably half a dozen, maybe a dozen cases over 12 years where the claim against the dentist is a failure to diagnose and manage periodontal disease. But periodontal disease in South Africa is just has the same etiology as it has in the UK. It's just got there's a different focus, different lens that the lawyers take here, and maybe it's only a matter of time before that changes. But there's no perio claims here, and there's no perio claims in Asia, but there's tons in the UK.
I find that fascinating, Yak. I don't know if you picked it up, but there's an actual legal firm dedicated to suing doctors and dentists.
What was
Dental
the name
Law
dental law partnership.
Yeah.
So they actually calls it dental.
Yes. So I'm reluctant to focus on them, but because we might be giving the lawyers in this country an idea.
Exactly. I'm not going to say any more in case they're listening. They might be after me.
But it's fascinating that there's a company that just targets dentists.
Yes.
Yeah. What's the most difficult part of your job, or your job helping dentists?
You know, we all of us who are healthcare professionals have a pride and an ego, and one of the worst things that can happen to you is somebody tells you that you've been negligent. Okay, and I think the hardest thing to do is to say to members here, look, we're going to have to settle this claim because we can't risk taking you to court when we don't have a supportive expert to say that your treatment was of a reasonable standard. And everybody, you know, no matter how you frame it, okay, it's criticism, okay, and it's a fellow professional criticizing another fellow professional, and some people don't take it as easy as others. Some are just glad that we're going to take the pain and the stress away from them, but others feel very strongly about not having the opportunity to have their day in court. And you'll know that you don't go to court unless you've got a nailed-on case, and that's probably the hardest bit. But you know, I've had I've had 2 or 3 members over the years, not in South Africa, whose careers have been ended because of addictions, alcohol addictions, and one dentist who I knew really well, who had alcohol addiction, and not far from where I lived, one night went out, having had a big drink, and fell asleep in the snow and died. And it's that sort of thing. There are members who take their lives because of the stress of the investigation. And you have some difficult cases where it's addiction and health issues, and the health issues are really difficult to deal with.
Yeah. So that was the negatively couched question where I said, what's the hardest part or the most difficult part? What's the best part of the job?
The hardest part is dealing with the health issues and giving people bad news.
And the best part?
The best part of it is meeting colleagues and helping people and making them better by resolving complaints and things like that. And it is, you know, there's a sense of satisfaction, not my satisfaction, but satisfaction for them. And, you know, to hear somebody say thank you, and you know what it's like, because you've been with me in South Africa, people come round and sort of want to shake your hand and say, you won't remember me, but there was such and such a case. I just want to say thanks for the help that you gave me. And I'm saying, look, I'm only doing my job, but that's really nice of you. But I'm not in it for the glory. I feel I'm quite a humble person. I just like doing the job to the best of my ability. And if I can do it well, I'm probably helping 1 or 2 dentists.
I mean, just to give people a sense of the scale of the amount of work you've done and people you've helped. When we had congresses and somebody stops by and says, "Hey, Alasdair, thanks so much," and I say to you, "Alasdair, who's that?" And like, I can't remember. Like, that's the number of people that have been helped and touched.
But also at the same time, like your guys' job is difficult. It's you dealing with people that are coming in that are already on the back foot emotionally, clinically, probably financially as well. Because no one comes to you and everything's good. When something goes wrong, that's when you got to deal with this person. And that's why I'm glad you mentioned the best part of your job is, you know, meeting colleagues or whatever it is. Because even those positive outcomes are kind of still born out of something that went wrong. And people probably don't even want to acknowledge that they know you.
And sometimes there's negative outcomes. It's not always positive.
Yeah.
And
I mean, the jeopardy in the UK from the regulator is serious. I mean, the General Dental Council have got some teeth and they bite. I'm not convinced the HPCSA have got the right teeth, and they don't bite very often. I think that the jeopardy of an HPCSA investigation for the dentist is probably not quite as serious as in other jurisdictions that we provide our indemnity in. So that's one good thing. But you need effective regulation to keep standards up, and the less effective they are at investigating and sanctioning the dentist, they're probably just as inefficient at maintaining proper professional standards and making sure that the dentists are doing the right thing here.
Yeah. So let's have some tea then, I guess, or if you want to, spill the tea. What's the worst case you've ever dealt with? If you can remember.
Yeah, I can. I mean, for reasons of confidentiality, I can't go into it. But
of course, yeah.
Yeah, I've had one or two cases. I mean, I can remember a case a few years ago where we said to the member, "Sorry, we can't help you. You're not in the right grade of membership." "Oh, yes, I am." And there was a big fight, and it went on and on and on for months. And there was a complaint made. The relationship becomes really, really, really difficult. And so that member management was one of those things. And I always felt that his membership ended. We refused to renew him, and I always felt that there would be probably a hit out on me every time I pulled up in Joburg, or turned up at an event, because people are generally not very happy when MPS make the decision to terminate their membership, and generally on good grounds every time. I've never seen a bad decision to terminate a membership at MPS. The circumstances are properly looked at, and the decisions are always right.
Yeah. Well, that's actually, it's good from my point of view, because when I asked the question, I was thinking about, bad outcome for the dentist.
Yeah.
It sounds like a good outcome for that practitioner.
Well, he was lucky, yeah.
Yeah. Any further tea you want to hear?
No, I mean, I don't want to put Alice in the position where he has to.
Okay,
he can't.
Lawyer.
But what's next? I mean, what's the plans? Because it's you're leaving the place now, right?
Okay, so in 2019, MPS made a decision to get closer to their members in South Africa, and we've now got a CEO who's very keen on having a global position rather than having this UK base. And in 2019, we made the decision to move all our South African work, both on the case handling and the business side, into teams in South Africa. So you work for a subsidiary called MPS SAS, who now handles all the dental and medical cases in South Africa, which means my desk in the UK is empty. On the business side, I used to make all the decisions about what lectures, what conferences we went to, what we did. I had a budget, and that got taken away from me probably about 2020 as well, and devolved locally into a business team. So even though I was called head of dental services and still am today, it really is a title that didn't exist, and I haven't had any skin or interest. I've had plenty of interest in South Africa, but no interest in the decisions that are made about how the cases are handled, or how we position ourselves from a business perspective here. So it's the end of the road for me with MPS. They've decided that this role no longer exists, and they're offloading both myself and Graham Howers, who's head of medical services, with effect from next week, which is the end of July.
Yeah. And look, we're at the flagship Dental Congress currently. For those watching it now, it's towards the end of July. And how the dentist, what's the feedback been for you? Like,
sorry, before you answer that, this is some independent evaluation yesterday. Yeah, because you guys were on stage speaking yesterday, and then Yash had a pause, and he said he wanted to just say something personal before the end. And I mean, a lot of people at these congresses, I was sitting at towards the corner at the end, and I was looking at everyone, and everyone looked up. And then he said what he needed to do, build up quite a nice effect there. And then he said what he needed to say. And you came on and you said what you needed to say, but you kind of started walking off the stage. But did you notice that you had a standing ovation at that? Because a lot of people actually appreciated what you have done over the years.
Yeah, I did. I mean, obviously we knew that Yash wanted to have his minute and just say some stuff about how we've managed to work together and learn from each other, and we're good buddies and we can shout at each other and fall out and do all that sort of stuff. But I realized then that there's a lot of people out there that in that audience are going to be thinking, what on earth's going on here? Because McKelvie said nothing. Yeah. There's been no announcement. There's been nothing said by SADA. And I remember last year I got an award in Pretoria from SADA. And in my acceptance, I kind of suggested that I wasn't sure whether the end was near or not, because at the time I didn't know. But so Yash gave me the opportunity. Well, I felt I couldn't walk off stage without explaining what this was all about, which is why I very quickly just gave that 5-6 year history of moving things away from the UK, and eventually my role becomes redundant because there's nothing for me to do, and they can't redeploy me into another role, equivalent role in the business. So it's bye-bye McKelvie. But as you say, yes, when I walked off the stage, I was feeling kind of emotional about it all. And I did know people were up and standing, and that's lovely. I mean, I've never had that before, or I've never felt that love before by an audience, and I really appreciate. And it tells me that whatever I've done, I've helped. And I can't. If you said, how have you helped in South Africa? I would just say, just like any of you guys, just doing your daily job. That's all I've done. And I've been lucky enough to do it in South Africa, where I've made a lot of friends. And so I feel quite emotional about leaving. I find it difficult to talk to people about the fact that this was the end, and it's a surprise because nobody expects it. They just expect you to be part of the scene every year. And when you think of before the pandemic, I used to be down here 4 or 5 times a year. So I was a regular visitor. We did a roadshow. So I was popping up in lots of different places, lots of different branches, doing lots of different events and conferences. And then the pandemic came, and that's when MPS realised that they could do things virtually, and we had to do it through webinars. I don't think webinars are the solution. I think that, just like the conference today, the people need face-to-face contact. They need the colleague-to-colleague stuff. And the fun we had on Friday night and then Saturday night, where you get like-minded people joining together, having a few cocktails and a dance around. It's been absolutely brilliant. And it is every year here. And that's something that we really look forward to, that you lose out with all the virtual stuff.
Yak will know this, or so all of us in this room will know this, but dentists are not easy to please, right? So I think we must pause and just acknowledge that there was a conference room, hundreds of dentists, that nobody forced them to do it. I was in 2 minds about saying what I said the other night, but I was so glad in hindsight that I did it, because everybody rose to their feet. And
I've never seen that.
And they applauded the guy. So, when I saw that happening, I was like, okay, it was the right decision to make. And so I just want to highlight that.
Listen, I'm grateful to you, and I mean, it'll be a memory I take away from here. I mean, I keep saying I've never wanted to be a hero anywhere. I think there's something very special about an organisation that looks after their members with technical expertise, with healthcare professionals who really, really understand how the dentist or the doctor got into that difficulty in the first place, how they're feeling and how they need to get out of it. And it's a special relationship that I guess won't exist anywhere else, particularly in the world of commercial insurance.
Okay. So what's next? Are you moving to South Africa?
Yeah. No. But I mean, when I told Cobus Barnard that this is the end, he says, "Oh man, you just need to buy a house in Fancourt near a golf course and move here." So, no, but I will continue.
I agree.
I will continue to come back to South Africa. I mean, listen, I don't know if it's the end of my career. You just never know what options turn up, and there may be other associations or insurers or indemnifiers who have got their eye on the dental environment in South Africa that might want an old guy with a bit of experience, but maybe not. So I need some time off just to regroup. I haven't had more than 2 weeks off work in my life from the summer of 1984. So, that's just the way it's worked, guys. I mean, I planned to have a bit of time off between selling my practice and coming to the MPS, but it hasn't happened. So, there's some downtime. We've got lots of things to do. It's summer in the UK as well. So if you're ever going to be a good time to be laid off your job, the summer is when it's going to be. And I'm going back tomorrow night. And I got to hand in all my stuff on Thursday, and we were having a big celebration on Thursday night in Leeds. Nothing to do with MPS. This is a party I'm hosting for myself and my friends, so we can all come along and shake hands, have a cuddle and a kiss, and bid everybody farewell.
Yeah, I wish I could be there. Hashtag no invite. But I have one question for you. As I've been dying to ask this, not just now, like from the time that I got to know you and I realized that this guy was working with you. And you mentioned it yesterday, like you guys closing the door and shouting on the phone and all of that. But how is it work? You can see by his facial expression, he's a
I'm worried.
He's a grumpy ass.
I'm worried where this is going. Yeah.
But how was it working with Yash? I mean, he's a fraction of your whole career, and you've come across many like this grumpy dentist.
Okay, well, I wish I'd had some time to think about this question. Okay, because there's a variety of answers I could give. Okay, so
remember the honest one.
Okay, so I used to. Annalene uses the word I all the time, but MPS used to do business with Norton Rose, okay, when you were working at Norton Rose. And it was, I loved working with Norton Rose. I thought your boss, Maria Philippides at the time, was one of our best attorneys, and she really looked after our members well. And I mentioned to you the other night about going into the Norton Rose building in Sandton, and it was just like going into another world. It was opulent, and whenever we'd a member meeting there, the refreshments were brilliant, and that's where I met you. And at the time, we didn't have a presence in South Africa for anyone to handle cases in the team. But you were always asking me, can I work for MPS? And I remember that with when Margie van Gogh was in charge. And I think I said to you, I think there'll be something happening. And of course it did. And you got the role. And, I knew that you were going to be the right person for it. It's been good fun. I've learned a lot from you. The shouting is funny because there's raised voices on both sides, okay? And it happened 3 times that day, okay? And there's one of the managers in the office came round to me in the middle of the shouting and put a note on the table, say, "Can you lower your voice?" Okay, so I did, okay, and then the call ended, and then we had another one about half an hour later, and it was even louder. So another note came and said, "You're interfering with everybody's peace." So then the call ended, and then there was a third call. Geez, and there was nowhere for me to go in the office. There were no rooms to go into, and I didn't have my headset on, and he just went ballistic with me afterwards, and I got into serious trouble just for shouting.
You know what? I feel like I always say you're not really friends until you've had a disagreement or a fight. That's when I knew Alasdair is my actual friend, because we.
Well, I think. Listen, I'm not going to be. I've got lots of female colleagues in the office as well, though. But I think the main thing is that eventually we can agree to let bygones be bygones, and make up. And I think that it was much better when we did. And it's. He's got a tough job now because he's a single resource. He's the only dentist looking after the membership in South Africa, whereas when I was doing it, I had some backup initially from Hugh Harvey up in the Edinburgh office, and then laterally from Jim Lafferty and Louise Eggleton. I could always pass stuff on to them when I wasn't there or when I just got too busy or whatever. But there was a time in my career when I would travel to South Africa and I'd have to do my casework at the end of the day and into the evening because there was nobody else that would help me. So, and I've always had this thing about how long have you worked for MPS, and when we got to 10 years, James and I would say, whoever was asking, well, we've been employed for 10 years, but we've actually worked for 15 because we did so much that was out of hours. And you know, this is probably my 60-something trip to South Africa. And, you know, it takes its toll. It takes its toll on personal relationships as well to be away overseas. And it's you know, you make friends, and he's one of my friends, and even though we're stepping down next week, I'll still be in touch with him. I'll know what he's up to, I'll know what he's doing.
Definitely.
You know, I said it yesterday that the membership are going to be in good hands while he's there.
Yeah, appreciate it. So what's the short-term plans? You can play some golf and
Yeah.
fiddle about. What are you going to...
Yeah, when I get back, we're away on holiday next week, up to Scotland. I've got a little cottage looking over the sea in the island of Arran that I own with my sister that's been passed down through the family. So we're doing that. Loads of golf. And earlier this year, I did a cycling tap round Loch Ness, which was about 68 miles with the Killer Hill, and I stupidly agreed to do another one on the 8th of September around Peebles, which is slightly longer. So what I do is when I stupidly say yes, I enter these things. I then speak to my colleague Jim Lafferty. Jim knows everything about everything, and I say to Jim, I'm doing this. What do you think? And he gets the route out and he has a look at the hills and he tells me, you won't make it, McKelvie. and from that moment on, I say, I will do it, Jim. Just wait and you see. So I'm doing that in September. We're going to another holiday to Corfu, which we always do every year, and then some golf stuff in October, November, and after that, who knows, I'll have got bored with doing nothing and going to the gym and playing golf, and I'll probably start thinking about what else I can do.
Moving to South Africa, yeah.
No.
If Yak and I or Yufti and I come to Scotland, we've got free accommodation. We can shack up with you.
Absolutely. You lot will be cold though. I mean, you just...
Yeah. But you guys have central heating.
I've seen you lot turn up to work with your outdoor coats on, sitting there, and it's 19 or 20 degrees. You know, if it's 19 or 20 degrees back home in the UK, we're in our shorts and T-shirt.
Yeah. So Alasdair, I'm glad you came on the show, and thank you for giving us your time. I am going to miss you, as I said last night. But as you mentioned, we'll be in touch and we'll carry on communicating. And who knows, maybe I'll see you at one of our competitors in the future.
But you know, I mean, the thing is, it's very easy to come to South Africa. You just got to sit in the plane all night and put up with that, but there's no time difference, and there's a lot of sport here. There's great golf, there's good weather. I'm going to be back down, absolutely no problem. The UK is different for you guys because your money doesn't go very far, and it's expensive to come to the UK. But you know, you'll always have somewhere to stay without there being a charge for accommodation or anything like that. And one of the things I know both of you will like is that I live across the road from two pubs.
Yeah, giveaway. Yeah, what a cheapskate. You know, he's not asking for free accommodation for both of us. Oh, maybe he is.
Well, I have got some spare rooms. You know, it's not a castle, but it's got more than one bedroom.
Yeah, but I just wanted to also say thank you for not just being who you are to dentists in its entirety as a profession, but also to this guy, kind of making an honest man out of him. I've seen his transition from the time
he was dishonest before.
No, this morning. But I've also noticed his transition, and Yufti, his wife, would also agree. He never used to be this guy that used to go out and speak and like do this sort of stuff.
It's difficult.
But after joining MPS, he's done a lot more of that.
He said to me yesterday, do you get nervous before you go up and speak? And Absolutely, everybody gets nervous, and you never ever get over the nerves. And I find the more you do of face-to-face stuff, the easier it is to get up and do it. And I used to do a roadshow here where we'd end up going to 8 or 9 branches, and we'd do it with KC and Cobus, or KC and Dr. Quinda when he worked for the HPC CSA. And you would learn so much about your presentation and your talk each day that by the end of the week, the presentation you ended the week with is completely different from the one that you started with. And the problem of doing one-offs like we did yesterday is that you've never really had the chance to try that one out. You don't know how it's going to work. There's only so much rehearsing you can do of your subject. And then you're faced with this environment on the stage yesterday where it was really difficult to see. It was really difficult to see your slides, and setup's important as well. And normally we work off our laptops in front of us, and that was different. So all of a sudden you're doing something that you're not familiar with in a completely different environment, and you're nervous, and those things never ever go. There's always a degree of anxiety. You know, I get on the first tee in the golf course now, and I'm looking, right, where's the trouble on the left? Where's the trouble on the right? And I get anxious. You know, and I've just been on the driving range where there's no trees on the left and no trouble on the right, and I hit perfect shot after perfect shot after perfect shot, and I think, I've got it. I go to the first tee because there's some pressure and there's something going on out here. I put a completely different swing on it, and that's down to anxiety and nerves, and it's just the same. And the only way you can overcome them is to get really familiar and own your presentation. And I was just really envious of what Annalene said to me this morning at breakfast, is that she's done it about 40 or 50 times the same presentation. And that's when things become easy, and that's when you don't need to see your speaker notes or see what slides on. You just know automatically. But that's one of the problems of doing webinars and not doing face-to-face stuff, where you've really got to perform. Webinars are dead easy for the person who's delivering the webinar because you've got all your information in front of you, but completely different when you go out on stage and do a live event. And yeah, I was nervous just like him.
Yeah. Okay.
Well,
But
no, well, Yak alluded to it, but I'll just say it. I mean, I've learned a lot from you. You've uplifted me. You've made me feel safe in situations where I felt, nervous and unsafe, and I appreciate it all. I wish you could have carried on for decades to come. But who knows? Maybe we'll give the same presentation again someday. You never know.
You never listen. You never know what's round about the corner. I mean, the unexpected turns in my life are amazing. And there's things that have happened to me that I definitely wouldn't have expected and planned, and you know what some of them are. So you never know what lies ahead. And I could be back in South Africa working, maybe not. I don't think the MPS will turn around and see the video of last night with the people clapping, and there must be a video somewhere, okay? Yeah. And if there is, Stacey Mackle have found it, and it'll be out there, because Stacey loves following what I'm up to. But maybe management will see that and they'll stop me going onto the chair on Thursday, but I don't think so. I think my career with MPS is over, but you never know where I might reappear. Who knows?
Well, I think there's good things to come, and thank you so much, Alasdair, for even joining us today.
Yeah, thanks a lot.
Yeah, well, thank you both. I mean, I feel like it's a great honor to be interviewed by you two. Okay, I think
you should feel. I mean, it is an honor.
It is an honor, and I mean, it's been a really interesting hour, and it's taken me back to some places that I hadn't thought about for a while. So thanks very much, and good luck with the show.
Thanks, man.
Thanks.
Cheers.